look at society now, the average age in most European countries is about 40 years, and it is predicted to be almost close to 50 years around 2050. So the question is aging going to increase the use of healthcare services to a point that it might make it unsustainable for the health system? And this question has received some attention. Some initial research basically would just literally project the effects of aging on health spending. More recently, around 1999-2000, a hypothesis was put forward, that is that time to death matters. So most of our health spending happens around a few years before someone dies. So interestingly, some research seems to find that when one accounts for time to death, the effect of aging on health spending almost becomes insignificant. Now, that debate has evolved over time, and we know that there are other determinants, there are other factors in addition to time to death that matters in explaining the effect of aging on health spending. That effect of time to death has basically led to some health economists to talk about what is called a red herring. A red herring, as we all know, is that particular scenario where it looks like everything points towards the importance of, let's say, one effect like aging, but it turns out that there is something else going on that is explaining that initial effect. And what we are arguing in our paper is that actually there are multiple red herrings. One of the contributions of our research is to use very rich data, individual level data from a number of European countries following individuals over time all the way to their death. And what we know on top of that is the age at death of their parents. So that is actually quite important information to then look at what could explain differences in time to death across individuals. So that's one of the contributions of our paper, that we actually account for the changing time to death, which is something that most of the previous literature did not do. Then another important effect, another what we call red herring that we account for in our paper, is the effect of illness and morbidity increasing over time. So what we are doing in this paper is separating the pure effect of age from the effect of morbidity, right? And that we can capture very precisely in individual level data. And on top of that, we account for other potential determinants of morbidity, such as early life behaviors. For instance, obesity around someone's middle age predicts disability and morbidity later in life. So that is something that could not be done in previous studies, because they were mostly using hospital episode statistics, for instance, which would not look at individual specific data. So we incorporate this dimension into the study. So our effects not only control for the effect of morbidity, but as well the effects of early life behavior, which are so important. And then finally, something that previous research didn't do as precisely as we do, is looking at the effects of aging across different kinds of healthcare. So the effect of aging is unlikely to be homogeneous across different kinds of healthcare. So it's probably going to be more intense for long-term care and perhaps hospital care than for medicine use or outpatient care. So we have very precise information on the different kinds of healthcare that individuals use, and we can look at the specific effect of aging on each kind of healthcare. And interestingly enough, we find that the effect of aging is very heterogeneous, up to the point that it's not significant for predicting outpatient care, whilst it continues to be significant in explaining, for instance, long-term care, because long-term care seems to be very sensitive to aging, and it's just slightly significant, so it does predict, but in a very ameliorated way, the effect of aging on hospital care use. So it seems that aging in itself will not bankrupt the health system. It will increase the use of some types of care, but not all types of care. Essentially, what we are saying is that the effect of chronological age doesn't seem to increase dramatically the use of healthcare. Instead, what seems to be driving the use of healthcare, introduction of new technologies, that seem to increase the, for instance, the use of medicines, or or it might have an impact on hospitalizations. And often that effect of technology is not necessarily linear, so it could go in different ways. And then particularly what we are suggesting in terms of policy implications is that the health system should invest more resources on prevention, particularly on cutting down on health behaviors around individuals 40s and 50s. So cutting down on smoking and particularly obesity, which we know that increases disability later.